For decades, many men have been misled by promises of impossible growth, believing that their virility could be bought in bottles and creams. If you are over 60, you know that intimate life changes, but you also know that you deserve real information without tricks or false hopes. Today, we are going to debunk the myths with the scientific truth that protects your health and your well-being. In this discussion, we will explore why these products do not work and are medically impossible, the medical and financial risks associated with their use, and legitimate, evidence-based strategies to optimize sexual function and confidence. We are going to break down all the information step by step, combining scientific data, clinical examples, and practical advice that can make a real difference. This is not just a warning. It is a complete guide to understanding what truly matters for male sexual health. The penis is a complex organ that combines specialized tissues, blood vessels, nerves, and ligaments that work together to perform both sexual and urinary functions. It is mainly composed of the corpora cavernosa, which are two cylindrical structures that fill with blood during arousal, and the corpus spongiosum, which surrounds the urethra and expands into the glands. The skin that covers it is thin and flexible, designed to adapt to temporary changes in size during an erection, but it does not allow external substances to penetrate deeply. Suspensory ligaments connect it to the pubic bone, determining the angle of erection and contributing to apparent length. To visualize it, you can imagine it as a hydraulic system where every component has an essential role. The blood vessels are the pipes, the corpora cavernosa are the water tanks, and the skin is simply the cover that protects everything without changing its volume. Even if creams or oils are applied, they only act on the surface, unable to alter the internal tissue. The anatomy also includes a rich network of nerve endings that allows sensitivity and pleasure, aspects that can be negatively affected by irritating or improperly used products. Understanding this structure is fundamental to realizing why any attempt at growth through creams or oils is biologically impossible, and why the temporary changes observed by some users do not represent real tissue growth. Penis size in men is largely determined by genetic factors and the development that occurs during puberty. During this stage, hormones like testosterone stimulate the growth of the corpora cavernosa and connective tissue, defining the final length and thickness. Variability among men is wide, but most fall within a range considered normal according to numerous scientific studies. Before we continue, I would love to know something to connect with our community. Which city or country are you watching from? Write it in the comments. I enjoy getting to know people who genuinely care about their health, and it helps me create content that is more useful and relevant for you and your region. Let's get to the point. It is important to understand that once puberty has ended, usually between 18 and 21 years old, the tissue no longer has the ability to grow naturally. Like other physical characteristics such as height or the size of hand bones, there are biological limits that cannot be overcome through topical treatments or home remedies. Comparing it to other parts of the body, trying to increase penis size with oils is as ineffective as trying to lengthen arm bones by applying creams. Knowledge of genetics and development allows men to understand that the obsession with size is often based more on cultural perceptions and unrealistic expectations than on real physiological needs. Oils and creams promise results that science proves impossible. Their inability comes from the fact that they do not penetrate beyond the skin's surface layer, meaning they never reach the corpora cavernosa or the spongy tissue where growth would need to occur. For penile tissue to increase, it is necessary to stimulate deep cellular division and connective tissue proliferation, something that can only happen in a controlled way, generally through surgical procedures or specific medical treatments. A simple analogy can help to understand this. Applying oil to the skin of the penis is like trying to fill a water tank with a sponge placed on the lid. No matter how much you rub, the liquid will never reach where it is really needed. Moreover, oils do not modify the suspensory ligaments or internal structure, so any feeling of enlargement that some men experience is temporary and superficial, never real. This scientific understanding is essential to avoid false expectations and unnecessary spending, and to guide attention toward methods that can actually improve sexual function and confidence. Often, men who use oils or creams believe they notice some change in penis size, but these perceptions are due to temporary and superficial effects that have nothing to do with real tissue growth. For example, some products may cause slight swelling of the skin due to irritation or the action of certain chemicals, making the penis look redder and slightly more voluminous for a few hours. Similarly, stimulation or massage applied along with the cream can temporarily increase blood flow to the corpora cavernosa, producing a firmer erection and giving the illusion of greater length or thickness. These changes disappear quickly and do not permanently modify the organ structure. In daily life, this can create confusion. A man may measure himself after applying the product or after arousal and attribute supposed growth to the cream, when in reality it is a normal physiological variation. Understanding these temporary effects is key to not being misled by false expectations and to recognize that any observed result is purely visual and temporary, without real anatomical implications. If you review the medical literature, there is no peer-reviewed study showing that oils, creams, or topical products can permanently increase penis size. In over 20 years of clinical practice and reviewing urological research, it is clear that these claims lack solid scientific support. Some studies have evaluated stretching techniques, vacuum pumps, or surgical interventions, but all show that the use of oils or topical creams produces no structural change in erectile tissue. Manufacturers of these products rarely publish scientific data because they cannot prove effectiveness under controlled conditions. On the other hand, there are many legitimate treatments with medical backing, but these are aimed at improving erectile function or correcting specific conditions such as micropenis, not achieving miraculous growth. Understanding the lack of scientific evidence allows men to distinguish between commercial promises and what truly has medical basis, avoiding useless investments and unnecessary health risks. The use of oils and creams that promise to enlarge the penis can have negative consequences for the skin and sensitivity of this very delicate area. Many of these products contain unregulated ingredients, non-standardized plant extracts, and irritating chemicals that can cause severe allergic reactions or contact dermatitis. Men who experience these reactions may notice redness, intense itching, and rashes that interfere with daily comfort and sexual life. In some cases, repeated irritation can lead to scarring and permanent skin damage, affecting sensitivity and pleasure during intimate relations. There are clinical examples of patients who came to medical attention with injuries that required weeks of treatment and special care, all of which could have been avoided simply by avoiding unregulated products. Loss of sensitivity is particularly concerning because, even though a man might believe he is increasing his size, he could actually be worsening his sexual function in the long term. Understanding these risks allows men to make informed decisions and prioritize the health and integrity of the organ over empty promises of enlargement. In addition to skin reactions, unregulated products can be a source of serious infections. Many oils and creams are produced in facilities without proper quality controls, allowing contamination by bacteria and fungi. Applying these products to sensitive genital tissue can cause severe infections that require immediate medical treatment and, in extreme cases, can leave lasting consequences. Some men have developed infections that spread quickly due to repeated exposure to contaminated creams, leading to intense pain, inflammation, and complications that could have been prevented with simple safety measures. Safety of products applied to intimate areas is critical, and using unregulated substances represents an unnecessary risk that outweighs any potential benefit. Understanding this reality emphasizes the importance of not being misled by advertising and always prioritizing health protection over miraculous promises. The impact of spending money on products that promise penis enlargement goes far beyond financial loss. Men who invest hundreds or even thousands of dollars in oils, creams, and devices that do not work experience frustration and disappointment that can affect their self-esteem and confidence. This situation can generate anxiety and feelings of shame, especially when comparing themselves to unrealistic standards promoted by pornography and misleading advertising. Money spent on fraudulent products represents not only a useless expense, but also lost time and energy that could have been dedicated to improving overall health, physical fitness, or even developing emotional and relationship skills that are far more important for sexual satisfaction. Investing in healthy habits, sexual education, and legitimate medical support provides lasting benefits, while obsession with quick-fix solutions produces only stress, frustration, and zero results. Understanding these financial and emotional risks helps men prioritize their overall well-being over the pursuit of illusory solutions. The perception that enlargement products work is strongly influenced by the user's psychology. Men who use them tend to experience confirmation bias, seeing results where none exist because they desperately want the product to work. The natural variability of the penis, caused by changes in temperature, arousal, blood circulation, or hydration, also contributes to the illusion of growth, as these fluctuations are mistakenly attributed to the product. Additionally, the placebo effect can boost sexual confidence. Believing the penis is larger can make a man act more confidently, which in turn can enhance the sexual experience for both him and his partner. However, this improvement is psychological, not physical, and can be achieved without spending money or exposing oneself to medical risks. Understanding the psychology behind these perceptions is crucial to avoid being manipulated by misleading promises and to focus attention on real strategies that safely and effectively increase confidence and sexual function. A concrete example can help illustrate the reality behind enlargement products. A 28-year-old patient came to my office after spending $800 over 6 months on an oil that promised to triple penis size. He had followed the instructions meticulously, applying the cream daily and performing specific massages according to the product protocol. He also kept a weekly record of his measurements, convinced they were increasing. However, when I assessed his size using standardized medical techniques, I found that his penis measured exactly 13.2 centimeters in the erect state, a perfectly normal size within the average range. The home measurements he had taken were inflated by technique errors, wishful thinking, and natural fluctuations of the organ. This experience illustrates how money, time, and energy invested in useless products only create false hope and frustration, while the most important lesson is recognizing that sexual confidence and satisfaction do not depend on size, but on health, function, and personal safety. Penis elongation through suspensory ligament surgery is the only medical intervention that can increase visible length, but it does not affect girth. This surgery involves cutting the ligament that connects the penis to the pubic bone, allowing a greater portion of the organ to extend outward. However, the results are limited, usually adding between 1 and 2 centimeters in length, and come with significant risks, including scarring, chronic pain, loss of the natural erection angle, and inconsistent outcomes. This procedure is only recommended in extreme cases, such as medically diagnosed micropenis, and never for men with normal size seeking cosmetic enlargement. It is essential that patients understand the risks and have realistic expectations before considering surgery, and that this decision is made under strict medical evaluation and psychological counseling to ensure that the reasons are legitimate and the risks acceptable. For men interested in increasing penis girth, there are specific medical procedures that involve injections of fillers, such as hyaluronic acid or other biocompatible materials. These injections can temporarily increase the diameter of the penis, generally for 12 to 18 months, after which the procedure must be repeated to maintain the results. However, these interventions are not without risks. The material may distribute unevenly, forming nodules or visible irregularities, and in more severe cases, infections or tissue necrosis can occur. Before considering this type of treatment, a complete psychological and medical evaluation is essential to ensure that the patient understands the limitations, possible side effects, and the need for long-term maintenance. These medical options are intended only for men seeking controlled and safe aesthetic improvements and should not be confused with the miraculous or permanent growth promises often offered by unregulated commercial products. One of the most effective and safe strategies to improve the perception of penis size is body fat reduction, especially in men with significant overweight. Abdominal fat can cover part of the base of the penis, making it appear shorter than it really is. By reducing excess weight, 1 to 3 centimeters of hidden length can be revealed, significantly improving appearance without invasive procedures. In addition, weight loss provides multiple benefits for overall health, including better circulation, lower cardiovascular risk, and increased energy, which in turn improves sexual function and self-confidence. This approach combines aesthetic results with real functional improvements, demonstrating that a positive perception of size can be achieved safely, healthily, and supported by medical evidence. Unlike commercial products that promise enlargement without scientific basis, it is important to understand that obsession with penis size is deeply influenced by cultural and social factors. Scientific studies have shown that most men, with measurements between 4 and 6 inches, fall within the normal and functional range for mutual sexual satisfaction. Only a small percentage of women consider size a critical factor, while other aspects such as duration, emotional connection, communication, and sexual technique have a much greater impact on the intimate experience. Pornography and the entertainment industry amplify unrealistic standards, creating male insecurity and a thriving market for fraudulent products. It is essential to recognize that this concern about size is largely a social construct, and that skills such as empathy, confidence, and attention to a partner are far more important for sexual satisfaction than any extra centimeter. Understanding this cultural context allows men to free their minds from unrealistic expectations and focus energy on what truly improves sexual and emotional life. The most effective and safe way to improve sexual function and confidence is not through creams or devices, but by adopting healthy habits backed by science. Regular exercise strengthens circulation and endurance, contributing to firmer erections and better sexual energy. Proper nutrition, including a balanced diet rich in fruits, vegetables, and quality proteins, supports hormonal production and vascular function, both essential for sexual health. Stress management is equally critical, as chronic stress can interfere with erectile function and libido. Additionally, developing personal and emotional confidence directly influences sexual performance, allowing a deeper connection with a partner and a more satisfying experience. These practices not only improve intimate function, but also overall health, showing that investing time and energy in healthy habits produces lasting benefits far more valuable than spending money on ineffective enlargement products. For men looking to optimize sexual function safely and effectively, there are natural supplements supported by scientific studies that improve circulation, energy, and erectile function without promising impossible enlargement. Organic watermelon extract, rich in natural L-citrulline, helps increase blood flow and supports firmer erections, providing a real effect on sexual function and confidence. For more comprehensive optimization, a combined formula is recommended that includes ingredients such as horny goat weed, tonkat ollie, fenugreek, and nettle root. Horny goat weed and tonkat ollie support hormonal and vascular function. Fenugreek enhances libido and sexual energy, and nettle root contributes to prostate health. These ingredients have been studied and published in medical journals, distinguishing them from commercial products that promise enlargement without evidence. The key is to invest in real sexual function and proven sexual health, not in unrealistic growth expectations, focusing energy on optimal performance, genuine confidence, and overall well-being.